The range and quality of healthcare services provided by Medway NHS Foundation Trust have gone from strength to strength. This year, the Trust was pleased to open the George Harwood Neuroscience Unit, preventing the need for local neurology patients to make journeys to London. It also created the Birthplace, a new maternity unit led by midwives. This new unit will cater for up to 1,000 births a year, offering a comfortable home-from-home environment, where the emphasis is on a relaxed birth experience which involves partners at every stage. Medway NHS Foundation Trust is committed to improving the quality of care and treatment across the organisation. To demonstrate this commitment, the Trust compiles a quality account. Every NHS healthcare provider is now required to publish this document annually, so individual provider performance can be assessed against national standards.
The quality account is very similar to the financial accounts that a company have, but it is explaining the quality of care throughout the year that we provide at Medway. And the quality of care is about how safe the patient care is, making sure that the patient experience is excellent, and also making sure that we give the best up-to-date care.
The Trust Board has continued with its commitment to improve patient safety, patient experience and clinical effectiveness of treatments. Every board meeting now starts with a patient story, which brings to life the strategies agreed and those being monitored, enabling the Trust to identify best practices, as well as those areas where more focus is needed to make improvements. This helps to ensure that the Trust offers more tailored, seamless and high-quality care and treatment in line with the needs of its patients. Over the past year, excellent progress has been made in eliminating healthcare-associated infections, particularly in having no cases of MRSA bacteremia for a year between 2010 and 2011. Every adult inpatient, with the exception of maternity, is tested for MRSA, which means around 400 samples are tested in the Trust's microbiology laboratory every day.
We've undertaken quite a few different measures. We've started with the introduction of a specialist ward for our MRSA patients, so all our patients are looked after together. We've undertaken lots of work about the management of devices, so things such as urinary catheters, IV drips, and we make sure they're managed right every time for every patient using some high impact interventions. We've also focused a lot on MRSA screening, so all the patients who come to Medway are screened for MRSA, then they're screened every week once they stay with us for more than a week. And then obviously the most important factor about any infection prevention and control is good hand hygiene, so making sure everybody washes their hands either with soap and water or using the alcohol hand rub.
The Trust's Patient Safety Project ensures that all staff at all levels are involved in this important work. And as a result of the Trust-wide commitment to patient safety, fewer emergency incidents of patients becoming very unwell and requiring high dependency care have occurred, and inpatient falls have declined.
This is a WonderGuard alarm. It has the beauty that it attaches to the patient, and it also gives you a idea that the person is leaving the bed, and gives you an extra warning so that you can get to the person before they leave the bed. It's also good to be used in the toilet to maintain privacy and dignity, so that the patient can have it in the toilet. As soon as they get up off of the toilet, this will pull and it will alarm, and the nurse can enter the toilet then to help the patient.
Privacy and dignity is very important to the Trust, and it has made good progress over recent months to eliminate mixed-sex accommodation. The local patient survey showed that in the period between January and March 2011, 95% of patients who completed the survey felt they were treated with dignity and respect whilst staying at the hospital. Last year, the Trust embarked on a programme called Enhancing Quality. This is a programme that uses quality measures which indicate whether the patient has received care that ensures the best possible outcome. The Trust has also incorporated the Enhanced Recovery Pathway, a new approach being rolled out which looks in detail at the care patients receive before, during and after surgery. Enhanced recovery begins when a decision for an operation is made. During pre-operative assessment, patients are given verbal and written information about the Enhanced Recovery Programme, including a diary containing daily goals to achieve. The diary is used as a way to encourage and allow the patients to have an understanding of what they're able to achieve and what they can expect to happen during their hospital stay. The patients also receive written discharge information to enable them to plan their discharge with family and friends.
I'm a consultant orthopedic surgeon. I do mainly knees and hips surgery. Within the enhanced recovery, enhancing quality pathway, we are introducing certain measures to improve the quality of outcome of the patients, which include reduced VTE, which is blood clot rates, and reduced infection rates. So the main advantage which is expected from these measures is better outcomes for Medway patients.
There is a long way to go until the Trust achieves all that it aspires to, and there are of course areas where more focus is needed to achieve further improvements. This includes further reducing the number of inpatient falls, people treated in mixed-sex accommodation, year-on-year complaints and pressure ulcers. The Trust will continue with its commitment to improve the quality of care and treatment, whilst ensuring the best range of services are offered, suited to the needs of patients the Trust serves. You can read more about the priorities for this year, including details on the 9 key areas being focused upon, in the full quality account document. The full and summarised versions are available on the Trust's website.